Hello everyone, this is Dr. Prashanth and welcome back to Public Health Series. In this video, I'll be briefly explaining the national health policies starting from 1983. Health policy refers to decisions, plans and actions that are undertaken to achieve specific healthcare goals within a society. And the first national health policy was formulated in 1983 and it laid stress on preventive, promotive, public health and rehabilitation aspects of healthcare. The primary objective was to attain the goal of health for all by 2080 through the comprehensive primary healthcare services. These are some of the key initiatives under the policy. Setting up a well-dispersed network of comprehensive primary healthcare services linked with extension and health education designed in the context of the ground reality that elementary health problems can be solved by the people themselves. Intermediation through health volunteers having appropriate knowledge, simple skills and requisite technologies. Establishment of a well worked out referral system to ensure that patient load at the higher levels of the hierarchy is not needlessly burdened by those who can be treated at the decentralized level. An integrated network of evenly spread specialty and super specialty services. Encouragement of such facilities through private investments for patients who can pay so that the draw on the government facilities is limited to those who entitled to free use. So, some of the policy initiatives outlined in the NHP 1983 have yielded good results, while in several other areas the outcome has not been as expected. So, there are some factors which led to the question of need for a new policy. They are morbidity and mortality levels in the country are still high even after the implementation of the 1983 health policy. And also the extremely virulent communicable disease, that is HIV, has emerged since the declaration of NHP 1983. And also common waterborne infections like gastroenteritis, cholera and some form of hepatitis contributed to a high level of morbidity in the population. There was also an increase in mortality through lifestyle diseases like diabetes, cancer, etc. during the period after the announcement of NHP 1983. And finally, the most important one, the financial resources and the public health administrative capacity is far short of necessary to achieve the goal of NHP 1983, that is health for all by 2000 AD. So, the changed circumstances relating to the health sector of the country since the implementation of 1983 policy led to the formulation of the new health policy, that is National Health Policy 2002. The main objective of NHP 2002 is to achieve an acceptable standard of good health among the general population of the country. These are some of the key points of NHP 2002 to increase access to the decentralized public health system by establishing a new infrastructure and also by upgrading the existing infrastructure. To ensure a more equitable access to health services across the social and geographical expanse of the country. Increase the aggregate public health investment through a substantially increased contribution by the central government. Enhance the contribution of a private sector in providing health services. These are the goals of NHP 2002: eradicate polio and yaws by 2005, eliminate leprosy by 2005, Kala Azar by 2010, lymphatic filariasis by 2015, achieve zero level growth of HIV/AIDS by 2007, and by 2010 reduce the mortality of malaria by 50%, reduce the prevalence of blindness to 0.05%, IMR to 30 and MMR to 100, and increase the utilization of public health facilities from the existing, which is less than 20%, to more than 75% by 2010. Increase the government health expenditure GDP from 0.9% to 2% by 2010. Increase share of central grants at least 25% of total health spending, and also increase state spending from 5.5% to 7% of the budget by 2005 and further increase to 8% by 2010. The improvement in the quality of health services is not exclusively dependent on the financial or material inputs, but also on more empathetic and committed attitude in the service providers. So they need to treat it as a responsibility rather than the commercial thing, right? And now coming to the question for the need of a new policy, 14 years after the implementation of NHP 2002, the context of healthcare has changed in four major ways, starting from growing burden of non-communicable diseases and some infectious diseases, emergence of a robust healthcare industry, growing incidence of catastrophic expenditure due to healthcare cost, a rising economic growth has enhanced the fiscal capacity. Therefore, a new health policy responsive to these contextual changes is required. This led to the formulation of National Health Policy 2017. The aim of NHP 2017 was to inform, clarify, strengthen, and prioritize the role of government in shaping health systems in all dimensions. The goal was to attain the highest possible level of health and well-being for all ages through a preventive and promotive healthcare orientation in all developmental policies and universal access to good quality healthcare services. The objective was to improve health status through concerted policy action in all sectors and expand preventive, curative, palliative, and rehabilitative services provided through the public health sector with focus on quality. These are some of the targets of NHP 2017. They are broadly categorized into three parts. To start with the health status and program impact, increase life expectancy at birth from 67.6 to 70 by 2025. Reduction of TFR to 2.1 by 2025. Reduce under 5 mortality to 23 by 2025 and MMR to 100 by 2020. Reduce IMR to 28 by 2019. Reduce neonatal mortality to 16 and stillbirth rate to single digit by 2025. Achieve the global target of HIV by 2020. Eliminate leprosy by 2018, Kala Azar by 2017, lymphatic filariasis by 2017 in the endemic pockets. Achieve a cure rate of more than 85% in new sputum positive patients for TB and reach elimination status by 2025. Reduce the prevalence of blindness to 0.25 and disease burden by one-third. Reduce premature mortality due to non-communicable diseases like cancer and diabetes by 25% by 2025. Now coming to the health system performance indicators, increase utilization of public health facilities by 50% by 2025. Antenatal coverage above 90% and skilled birth attendance above 90% by 2025. More than 90% of the newborn are fully immunized by 1 year of age by 2025. Family planning above 90% by 2025. 80% of non-diabetic and hypertensive individuals at household level maintain controlled disease status by 2025. Reduction in prevalence of tobacco use by 15% by 2020 and 30% by 2025. Reduction of 40% in prevalence of under 5 children stunting by 2025. Access to safe water drinking and sanitation to all by 2020 Swachh Bharat Mission. Reduction of occupational injuries by half. And now coming to the last one, health system strengthening, increase GDP, that is spending, from 1.15% to 2.5% by 2025. Increase state health spending to more than 8% by 2020. Decrease the catastrophic health expenditure levels by 25% by 2025. Ensure paramedics and doctors as per IPHS standards by 2020. Establish primary and secondary care facilities as per norms by 2025. Strengthen the health surveillance system and establish registries for disease of public health importance by 2020. And the last one, establish National Health Information Network, Health Information Exchanges by 2025. Thank you.